There is something that's slowly killing my family. Imagine you're at the doctor's surgery, waiting for your blood test results, and she starts the consultation with the words, "I don't want to worry you." That was me, July 2017, returning home from 8 weeks of international travel, feeling unwell, and finding out that I was pre-diabetic, at risk of type 2 diabetes. It was a shock, but it shouldn't have been a surprise. Type 2 diabetes is the single biggest cause of death on both sides of my family. Genetically, the odds are stacked against me. But it's the environment I'm in that shapes my food choices. Having said that, with a lifestyle of Prosecco parties and with being on first-name terms with the waitresses in my favourite restaurant, it was never going to end well. I had a further 6 weeks of international travel to do, so no time for self-pity. I had to get on with it. But I needn't have worried, because as I travelled through Hong Kong, Shanghai, and South Korea, healthy meals packed full of vegetables were everywhere I went. I'd been travelling for some time before I realised that I hadn't had any chocolate. Not because I didn't want to, but chocolate hadn't been obvious in my food environment, and I hadn't missed it. I returned to the UK, fitter and leaner, with a better understanding of how the food environment impacts on our health. Let me take you back to the 1980s. Anyone remember that? A few. Time of Finder's crispy pancakes, VHS videos, and rollerblades. Marks and Spencer's, the nation's upmarket food store, was building on the success of its very first ready meal, chicken Kiev infused with garlic. And Walls had launched Viennetta ice cream. You know that one? The soft white ice cream with its layers of crunchy chocolate folded in. Food was exciting, food was innovative, and food was very, very processed. The food industry, in its drive to bring us bigger, better, and cheaper food, had somehow lost the importance of food and its value to our health. The penny drop moment came for me after a 15-year career in the food industry. I left my job at one of the UK's largest food manufacturers and came back to university here in Chester to study for a master's in human nutrition. 2 years later, I was travelling the world on a scholarship funded by the Nuffield Farming Trust, researching healthy diets and looking for ways to improve our nutrition. Let food be thy medicine, let medicine be thy food. We've all heard that phrase, right? Yeah? It's been helping us to make stronger links between food and health over the years. But food isn't medicine. Medicine is something that you take to heal your body from disease. Food is what you need to sustain and to nourish you, and also for social and cultural interactions. Think office cake, family Sunday lunch, pizza parties. Now, I'd like to find out from you, the audience, about your relationship with food. So I'm going to throw out a series of statements. Feel free to raise your hands to as many or as few of these as you like. Raise your hands if you enjoy your food. Oh, great. We have a lot of people who enjoy their food. Now, raise your hands if you make your food choices based on taste. Oh, okay. Raise your hands if you make your food choice based on convenience. A few less, but okay. Now the last one. Raise your hands if you make your food choices based on the recommendations of Public Health England's Eat Well Guide. One, well, maybe two. I thought so. Food choice is incredibly complex, and food producers need to realise that and be aware of that when presenting options and food choices to the consumer. Back to my travels. As I travelled through Hong Kong and Shanghai and South Korea, I realised that the healthy choice is the easy choice. So, for example, the takeaways, the vegetable stir-fries with noodles, or the afternoon snacks that I had at the train station, a lunch made from chicken porridge and fermented vegetables, or the afternoon snacks of sticky bread buns filled with bean curd, were a world away from the chocolate crisps and sandwich meal deals in the UK. We need a culture change, and the food industry needs to be part of the solution. We have foods that we obsess about, try and ban from sale and exclude from our diet. But healthy and affluent people have a choice in this country. They have a choice because where you live determines the quality of your health. Healthy and affluent people have a choice because they can avoid some of the damage caused by a modern lifestyle. And healthy and affluent people have a choice because they can afford to pay for better quality food, even if they choose not to. But here's the thing. We're not all healthy and affluent with unlimited choices in the UK. We have a wide and varied population, very diverse. For example, we have a black and ethnic minority population, genetically at higher risk of type 2 diabetes. We have an older adult population at higher risk of malnutrition. And we have a teenage population at higher risk of hidden hunger. Despite overweight and obesity, all this extra food that they keep eating is not bringing them enough fibre, folate, iron, or vitamin A. We need a culture change, and the food industry needs to be part of the solution. It's about taking food from our farms, putting it through our factories without stripping away the fibre and important nutrients. It's about having a positive dialogue with the customer at the point of sale. For example, take Google HQ in New York. Haven't been, would love to go there. They have decided to make the healthy choice the easy choice by putting vegetables and salads at the front of store. Bearing in mind they don't sell the food, it's all free. People naturally gravitate to that part and take those foods first. The water is put in front of the juices and the fizzy drinks, but above all, the healthy food is tasty food, which means they get people coming back each time because they enjoy it and they're building a good relationship and a good story. So what's in it for the food industry? Business needs to make money. Factories, they need to pay their workers, they need to pay for the ingredients, they need to pay their taxes, they need to reinvest in their business, so on and so forth. But is the focus on continual growth and profit, is that sustainable for the future of food? So I'm going to demonstrate sustainability with the help of my trusty model. Now, if you're wondering, did I make this myself? Totally didn't. But what I'm going to demonstrate is what happens when we have a focus on profitability. Pray for me as I get down on my knees. Made it. So you see what happens? The model is now unstable. If a company buys cheap food from a country where there's water stress or drought, that has a negative impact on the planet. If a company buys its ingredients from a business that uses forced labour or child labour, that has a negative impact on people. Is it straight? Yeah. If a business focuses on putting out more and more product that contributes to type 2 diabetes, that's not sustainable. If a business focuses on creating wonderful meals for older adults but doesn't make a profit, that is not sustainable. And when a business decides to expand its range of foods that contributes to obesity, that is not sustainable. The future of food relies on healthy choices being available for everyone, regardless of their disposable income, ethnicity, or nutritional needs for their age group. People make choices from what's available in their food environment, and if that environment is unhealthy, then that is not sustainable. When I was in China, I saw that supermarkets were serving nutritious food made to order. I'd wandered into a shop in Shanghai, placed my order for my hot meal, then realized that I didn't have the right app on my phone to pay for it, and they didn't take cash or card. In New Zealand, I saw and met up with a business group that was collaborating with fast food organizations to teach them how to cook chips properly. They were teaching them how to use the oil at the right temperature, to change the oil at the right frequency, and also to take out 2 or 3 chips out of some of the larger portions to reduce the number of calories without people noticing. In Singapore, a lovely place that I'd love to go back to, people pour out of their offices at the end of the working day to sit at the low wooden tables outside the street food kiosks where they can enjoy healthy meals with friends and with colleagues, and also unhealthy meals if they want to. But the government there encourage street food vendors to prepare healthy meals, and they monitor them for safety and quality. We need a culture change, and the food industry needs to be part of the solution. We have a diverse population with a wide range of needs. Just think of the last time that you were at the doctor's. Who were you sitting next to? Was it a crying baby, a nursing mother, an older adult, or somebody with chronic health issues? We need to tailor our food and make sure that everybody's needs are taken into consideration. And we have a flexible and adaptable food industry who already do that for people who've got food intolerances and allergies, so it can be done. The geneticist, Giles Yeo, says that your genes are like a hand of cards in poker. Some are good, some are bad. You can't change that at the moment. But how you play your cards depends on the environment and lifestyle, so you can control it. Changes to our food environment are absolutely crucial to support personal lifestyle and personal behavior change. We need a culture change, and the food industry needs to be part of the solution to make our food choices the healthy choice for everyone. Imagine you're back at the doctor's surgery, waiting for your blood test results. The atmosphere in the surgery is tense, full of anxious patients, and the memory of your last appointment hangs over you like a cloud. "Sorry to keep you waiting," says the receptionist as she hands over the printed sheet. "Here are your results. They're fine. The doctor doesn't need to see you now." Thank you.